All right, good afternoon, everyone. Just want to do a quick mic check and make sure everybody can hear me. Perfect, thank you. All right, my name is Melinda Southard. I'm the Deputy Administrator here at the Division of Healthcare Financing and Policy for Community Supports and Engagement, and I will be opening our presentation for you today. So a few quick housekeeping items before we start. For those joining us virtually, please be sure to drop the following information into the chat if you could. Please include your name, your agency or affiliation, and your email address. Also, a quick note that this meeting is being recorded. A copy of the recording will be available on the division's Market Stabilization Program website shortly. A notice will go out to the listserv when the recording is available, along with a copy of the link where it may be accessed. I would now like to formally open the public comment meeting related to the Nevada Battle-Born State Plans and the Market Stabilization Program. Joining me today and presenting will be Michael Gordon, the division's Waiver and Stakeholder Director, and our division administrator, Stacy Weeks. I also just wanted to say thank you all for being here with us today. As we go through the presentation for the state's 1332 waiver application, you will note we have a set time frame of 30 days for formal public comments. You will also have an opportunity to provide public comments today during the meeting, but we just ask that you please hold all comments or questions until the public comment portion of the presentation. And with that, we'll go ahead and get started. So the division will be hosting 2 public meetings to engage stakeholders on the state's 1332 waiver application. One of those is today, obviously, and the first one was actually on November 27th, and that information is posted on the Market Stabilization Program website as well. Per state law, the state's 1332 waiver application must be submitted to the federal government for approval no later than January 1st, 2024. This waiver seeks federal approval for Nevada to receive savings to the federal government from Nevada's implementation of a new state contracted health insurance options and a reinsurance program to both establish and finance a market stabilization program. Today, we will be providing an overview of the Battle-Born State Plans and Market Stabilization Program, provide an opportunity for questions and public comment, and then give an overview of the next steps in the state's waiver application process. The same state law requiring Nevada to submit the 1332 waiver application also requires the Director of the Department of Health and Human Services to contract with health carriers to offer new health insurance options. These options will be referred to as Battle-Born State Plans, or BBSPs. These new health insurance options of the BBSPs must be available to consumers who shop for health insurance in the state's health insurance exchange, otherwise known as the Nevada Health Link, beginning January 1st of 2026. The Battle-Born State Plan options will, for the most part, mirror other plans in the Nevada Health Link, with one exception. The BBSPs must meet an annual premium reduction target and pay their provider networks rates that are at or above Medicare rates. With that, I will hand it off to Michael Gordon to give an overview of the Market Stabilization Program.
Okay, thank you, Melinda. To continue, as Melinda was stating, the second key initiative is the Market Stabilization Program. The waiver proposes to use federal savings from the BBSPs to finance this program. The key goals of the program are to mitigate the potential risk of the new premium reduction targets on health carriers and the provider networks. B, reward health carriers and their provider networks if they improve health outcomes and quality of care, and ensure market stability in Nevada's individual health insurance market with the introduction of the new health insurance options and reforms. Continuing on, to achieve these goals, the governor has outlined 3 new initiatives. 1, a state-based reinsurance program at no cost to the state that is aimed at alleviating any unexpected financial risks to participating carriers and their provider networks with the introduction of the BBSPs. 2, a quality incentive payment program to reward high-performing health carriers and their provider networks. And 3, a Practice in Nevada program to provide incentives to more providers to live and practice in Nevada especially in rural regions of the state. These programs, if approved, would begin in plan year 2027 after the state receives its first year of federal savings under the waiver from plan year 2026. So some of the statutory requirements for the BBSPs. State laws require that the director to contract with the health carriers to offer the new battle-born state plans and use the director's Medicaid contracting authority to enforce certain state requirements. So in order to do this, participating carriers must offer these new plans to the Nevada Health Link and meet all federal and state standards for qualified health plans under the Affordable Care Act. Offer at least one silver and one gold battle-born state plan. Offer plans that will meet certain premium reduction targets, which will increase gradually to at least 15% over the first 4 years, and pay provider rates that are no lower than Medicare rates. And now I will hand this over to our administrator, Stacy Weeks.
Thanks, Michael. Good afternoon. So the new battle-born plans will go through a new state procurement process under state law. The director will be implementing this procurement process to establish the new contracts with health carriers, and will create a state private model for operating the new battle-born plans. This procurement must take place under state law at the same time as the state's next Medicaid managed care procurement, which we anticipate beginning the procurement process January 1, 2025 or earlier. Any health carriers seeking to participate in the state's Medicaid managed care program must also submit a good faith bid to contract with the state to offer and administer the new battle-born plans. The division will also use the new contracts as its tool for enforcement, similar to how the state uses its Medicaid managed care contracts today. And this includes enforcing the premium reduction target and other requirements under state law. Currently, division contracts with 4 health carriers for its Medicaid program: Anthem, Health Plan of Nevada, which is United Health, Silver Summit, which is Centene nationally, and Molina. Next slide, please. So this slide is really intended to give you a sense of how the battle-born plans look as compared to other plans in the market, and just a high level. As you can see on the left here is our non-group plan requirements. And when we're talking about our non-group plan, we're talking about individuals who go out on their own and purchase health insurance in the individual market. These products, if they're not sold on the exchange and sold on the exchange, so both, have to meet certain requirements that the Department of Insurance in Nevada oversees. They have to meet certain state network adequacy requirements under state law, state solvency standards, and state rate review process. So their rates must be submitted and reviewed and approved by our Department of Insurance, and they must be available, obviously, directly from the carrier. Now, any non-group plans that want to be offered through our exchange and available for tax credits, which we also refer to as qualified health plans, and noted here as a QHP, must meet additional standards, including all ACA standards for our exchange plans, all essential benefits. They have to provide and meet those requirements under the Affordable Care Act, all consumer protections that are afforded and through the exchange under the Affordable Care Act. They have to be certified by the exchange to be offered, and they also have to pay a carrier fee for the products. And they have to meet certain metal tiers and standards around those tiers for actuarial value and premiums. And they're available through the exchange, like I mentioned, and eligible for tax credits. On down here at the bottom is our battle-born plan. So I just want to maybe hopefully walk through the visual here. The 2 arrows that we just talked about for the other products apply to the battle-born plan. So in addition to meeting all the non-group plan requirements and all the QHP standards, the battle-born plan must in addition meet additional requirements that are available under state law and will be set forth in our contracts with carriers that participate. This includes meeting that premium reduction target, the minimum provider rate floor in terms of reimbursement, so they cannot go below Medicare rates. They have to meet any other contract requirements around quality or anything else that the state seeks as a priority. And they also have to offer at least 1 silver and 1 gold tier plan in the exchange. And they have to be available through the exchange as well as directly from the carrier. Next slide, please. There are a couple other requirements in state law that apply specifically to the battle-born plans that we thought we needed to walk through a little bit separate from their being offered in the exchange. This has to do with the provider network. So any provider that currently is under contract with the state of Nevada as a network provider in any other state contracted health insurance programs. This includes programs like Medicaid, our public employee benefit plan, as well as state's workers' comps plan, must participate as an in-network provider in at least one network with a battle-born plan. So any carrier offering a battle-born plan, if the provider participates in these other public programs, we ask that they also participate in at least one network with a carrier. These providers must also apply certain policies to accept new patients enrolled in the battle-born plan to the same extent as the provider accepts new patients enrolled in other private health insurance plans. And this is to avoid discrimination. State law requires a director to promote in its contracting process certain strategies with the carriers that bid on the battle-born plan. This includes better alignment to the extent feasible between Medicaid and the individual market plans. We're looking also with our carriers to find new strategies for addressing health disparities, both in Medicaid as well as individual market. Also, we're looking for strategies to improve cultural competency in our provider workforce and increase the use of value-based payment models with our providers, as well as addressing gaps in our healthcare workforce. Next slide, please. Just a little high-level preview of the actuarial study, which is tied to our application. So as part of our 1332 waiver application, we must submit an actuarial study. This slide walks through a little bit of those findings. According to the study, the 1332 waivers, which includes the premium reduction target and the reinsurance program together, is expected to lower premiums and generate savings for the federal government. And the savings comes from lower premium tax credits. So in other words, the federal government has to spend less on buying down premiums in our exchange to meet the Affordable Care Act standards. So we get to, under this waiver, capture that savings. So Nevada brings home these savings to fund these other state-based market reforms, which we call the Market Stability Program. And part of that would be the reinsurance program. The 1332 waiver is expected to achieve an estimated $279 million in federal savings in the first 5 years and $760 million at the end of the first 10 years. And again, it's because of the premium reduction target, primarily on the battle-born side of the waiver, and the other piece of the waiver is the reinsurance, and it's also driving down premium costs. So the new reinsurance program, based on early estimates the estimates from Milliman, anticipate that the reinsurance program will relieve the pressure on health carriers and their provider networks by half once it's up and running. So hopefully this will, in other words, instead of having to meet a full 3 or 4% each year, it's really cutting that down in half that the carriers have to meet. The state is simply subsidizing the cost of the premium reduction target with reinsurance. Next slide, please. Oh, we're done. So Michael, I'll let you open up for public comment. Thank you.
Hi. Thank you, everybody. If you would like to provide public comment, please use the raise hand feature, and we'll call on you in the order that those are received. And if you are calling in on your telephone, you may press *5 to raise your hand. So we'll go ahead with the first public comment. I have Helen Foley. Please go ahead.
Thank you very much. I am Helen Foley, representing the Nevada Association of Health Plans, which is a 10-member association of commercial insurers, including Medicaid managed care insurers. We are working on more detailed comments that we will submit in writing. And we want to start out by saying thank you very much to Governor Lombardo, his staff, and DHCFP for attempting to work on a market-based approach. We realize there are restraints upon you based upon the language of Senate Bill 420 of the 2021 session. But we do have some concerns with some of the specifics of the waiver related to the implementation of SB 420 as a whole. Those include, 1, tying the RFP process for Medicaid contracts directly to the offering of public option plans. We know the statute requires contracted MCOs to submit a PO plan but how closely the current draft of the 1332 waiver ties the two submissions together could result in destabilization of the Medicaid program and a lack of competitive bids when the state puts out the Medicaid procurement next summer. Also, because that's a 5-year contract, if a plan does not meet the certain level of reduction of premiums in maybe the second or third year, does that then jeopardize their entire Medicaid contract? Those are issues we want to further explore with the state. 2, there's a requirement for reductions in administrative costs in the PO plans. And that is also a very big issue for us. There are already established MLRs in the ACA compliant plans that dictate a minimum of 80% of the premium dollar be spent on direct health care and not on administrative costs. We believe this process is very sound and should be the same for the PO plans. Furthermore, most of the administrative costs that plans spend on an expansion of services for members are not directly covered as healthcare services. Reductions in administrative allowance would reduce the offering of these benefits. Third, the process for achieving the premium reductions directed in statute is an issue. As we have seen in other states, the premium reduction targets have not been consistently achievable. We would appreciate more conversation and collaboration with the state on how those targets are intended to be met, especially if the waiver is going to include possible penalties. We only need to look at our most recent history of the last few years with the pandemic to see that things can go haywire in a short period of time. And how would we be penalized for that? We appreciate DHCFP holding these public hearings to allow us to address some of the issues with the 1332 waiver application. The industry has been on record from the time that SB 420 was introduced near the end of the 2021 legislative session through the design phase of the program, and we have submitted 8 letters on the subject. There are several elements that we think will seriously call into question whether the public option can achieve the stated goals. We support the efforts, again, of the Lombardo administration through the market stabilization portion of the waiver, and we really look forward to working with the state on the other elements of the waiver application. Thank you so much for your time.
Thank you, Helen. Next, we have Maddie Guerrera. Please go ahead.
Hi, my name is Maite Guerra, last name Guerra, and I am the Anti-Disinformation Manager at Battleborn Progress, an institute for Progressive Nevada, and I am here to discuss how for decades wealthy insurance companies have raised health insurance rates and profited at the expense of hardworking Nevadans. We see many hardworking Nevadans unable to afford quality insurance that effectively covers their medical needs. And for that reason, I am here on behalf of the organization to show support for public option because it will increase insurance options for Nevadans who continue to struggle with affordable health care despite medical concerns for themselves and their families. Currently, 11.6% of Nevada residents lack coverage from either public or private insurance, placing the state among the bottom 10 in terms of health insurance inclusion. And public option aims to offer a cost-effective alternative for individuals ineligible for public insurance, such as Medicare or Medicaid, for those without employer provided insurance or those who are self-employed, and the effectiveness of Nevada public option insurance lies in its exemplary governance as it places the needs of community members at the forefront. So by offering a choice for Nevadans to obtain affordable health care, it grants them greater autonomy to make decisions that enhance the quality of Nevadans' lives. Thank you so much.
Great, thank you for your public comment. Next, we have Adam Zarin. Please go ahead.
Great, thank you. Good afternoon. I'm Adam Zarin, that's Z-A-R-R-I-N, and I'm the Director of State Government Affairs for the Leukemia and Lymphoma Society. Our mission is to cure blood cancers and improve the quality of life of patients and their families. Last week, we shared how Americans nationwide feel trapped by medical debt. Others in this meeting briefly shared their stories from across Nevada about their struggles to afford their medical bills. And this wasn't surprising when nearly 7 in 10 adults in the US say they are concerned about affording their health care. We also encourage the department to continue their focus on individuals and their experiences with the healthcare system. Our comments today are focused on how the state's policy can improve the quality of life for patients. Affordable, high-quality insurance is necessary to prevent medical debt. The public option plans will continue efforts to improve that for Nevadans. And we're glad that the proposed waiver is projected to increase marketplace enrollment. It will also reduce premiums starting at 3% in 2026 and almost 14% in 2028. It would also do so without jeopardizing provider networks and a quality of care for patients. The department can further improve these outcomes by funding the subsidies it contemplated in the first draft of the waiver. These subsidies immediately help patients in a meaningful way. Patients will still have out-of-pocket costs besides their premiums. Co-pays, co-insurance, and travel cause patients to consider delaying treatment or lead to medical debt that traps patients. Using pass-through funds for a premium subsidy will benefit patients more directly than reinsurance. So again, we would encourage the state to consider including it as they did in their first draft of the waiver. The public option will bring needed investments to improve Nevada's healthcare system. And overall, the public option does what it was set to do, reduce premiums, improve coverage, and save the state money. Thank you to the department and the legislature for their leadership in improving the patients' quality of life. And we hope that the waiver will continue through its process toward approval so that patients can enjoy the benefits of the public option. Thank you.
Thank you for your public comment. Next, we have Laura Rich. Please go ahead.
Thank you. Good afternoon. My name is Laura Rich, and I'm here on behalf of America's Health Insurance Plans. AHIP is a national organization whose members provide health insurance for healthcare and other related services. We remain laser focused on advocating for policy proposals that make healthcare better and coverage more affordable for Americans. First, I'd like to thank Administrator Weeks and her staff, along with Governor Lombardo, for all the work and effort that's gone into the development of this novel program for Nevada. Moreover, AHIP and its member plans appreciate the collaboration and stakeholder engagement that the administration has provided leading up to where we are at today. Every Nevadan should be able to access affordable, comprehensive coverage regardless of income, health status, or pre-existing conditions. However, we do not believe the public option will produce the desired results, and we can look to other examples from other states that have implemented similar programs, such as in Washington and Colorado, where the public option has yet to show it has been successful in driving down costs or making healthcare more affordable. As an example, Colorado only had Denver Health that could meet premium targets set forth by the state, with that particular plan only offering coverage in the Denver metro area. So although we do appreciate the efforts that have been made towards the development of the market stabilization plan to implement the public option provisions of SB 420, AHIP would like to offer the following concerns. First, the biggest concern is the way the proposed program ties the Medicaid market with the public option implementation. This requirement deters new entrants into the market and jeopardizes competition. Some carriers may excel at providing a great Medicaid MCO product, but may not be well positioned to do as well on the individual market. Medicaid and individual coverage are distinct products and distinct markets, and these markets should stand on their own. Tying the Medicaid and individual market may bring unintended consequences by bringing instability into an already fragile marketplace. We also have concerns regarding the more stringent MLR requirements set forth in this program. It's really important to note that administrative costs are comprised more than just profit, right? So these administrative costs include consumer impacting services that help the cost of care and increase access. These are programs such as 24/7 nurse lines, medical interpreters and translation services, fraud, waste, and abuse programs, and interactive technology and transparency tools offered by the health plans. So the ACA's MLR requirements, that's successfully working to place guardrails around those administrative costs, and the number of MLR rebates have gone down significantly over the most recent years. AHIP is in the process of reviewing the Section 1332 waiver application and determining additional comments prior to the December 20th deadline. In the meantime, we look forward to continuing our work with the administration and want to reiterate our appreciation for the stakeholder engagement throughout this process. Thank you.
Thank you for your public comment. Next, we have Jacqueline Nguyen. Please go ahead.
Yes, thank you so much for the opportunity to provide public comment. I'm Jacqueline Nguyen, spelled Nguyen, and I'm the Policy Director for the Nevada State Medical Association. On behalf of the NSMA, the state's largest and oldest organization representing physicians and physician assistants, we're here to express concerns regarding Nevada's proposed public option 1332 waiver. NSMA is committed to the goal of improving access to and affordability of health insurance for all in Nevada. We believe there should be health plan marketplace competition and that public options should have the goal of maximizing patient choice. However, this must be done with guardrails in place to protect patients and their physicians. Especially in Nevada with our dire physician shortage, any efforts to implement the public option without prioritizing access to care and physician workforce expansion will ultimately harm patients in our state. Since the inception of this policy, NSMA has stood with its healthcare allies in thoughtful opposition, but we understand the administration is required by law to move forward and therefore ask the division to consider the following concerns. In the public option, provider rates are tied to Medicare, which is set to receive a 3.36% cut in 2024 after receiving a 2% cut in 2023. Appallingly, physicians are the only Medicare providers whose payments are not adjusted for inflation. In fact, since 2001, Medicare physician payments have lagged 26% behind the rate of inflation. This is not a feasible benchmark. Additionally, for any services not covered by Medicare, the waiver states that reasonable rates will be calculated against the PEB rates or Medicaid. Mandating a proposed rate negates any negotiation position for physicians and poses a significant threat to the financial viability of medical practices. Therefore, while we understand Medicare rates are required by law, we ask that in the waiver, physicians have the ability to negotiate rates not covered within Medicare. The reality is this. Physicians who take Medicaid do so to provide a service to our community. In most instances, the Medicaid portion of their practice is a loss for the provider. This loss can only be supported by a carefully crafted payer mix. Increasing their Medicaid population by mandating participation in the public option disrupts this payer mix and jeopardizes the provider's ability to remain in practice. This may have the unintended consequence of driving many providers from the Medicaid system as a whole. We would ask for a waiver beyond the rural populations for physicians to opt out of mandated service in the public option. Regarding the specific waiver proposals, first, NSMA acknowledges that a reinsurance program may help alleviate disruptions to the insurance market. However, since the plan is tied to the public option, which mandates the new BBSPs to meet annual premium reduction targets, NSMA is concerned that there will be cost shifting to the contracted providers. NSMA urges for safeguards for providers that ensure that the premium reduction targets are mandated resource from efficiencies in carrier management. Next, NSMA agrees that a quality incentive program will work to incentivize carriers to use value-based measures to improve health outcomes. However, these measures cannot be made on the backs of already stretched provider populations. NSMA recommends that any quality incentive payment made to carriers also incorporates the criteria that such carriers demonstrate that they pay providers at a rate comparable to commercial rates. This will then be a dual incentive to carriers to accomplish the goals of improved health outcomes for patients while also recognizing the important goal of maintaining and then increasing the provider workforce. Finally, we applaud the state's plan to finance a new practice in Nevada program. In the waiver, the state asserts that increasing the number of providers is essential to addressing poor health outcomes and health disparities, and for controlling the rise in the cost of healthcare and ensuring the stability of the state's insurance market. NSMA wholeheartedly agrees. Therefore, we assert that the creation of the Practice in Nevada program should receive higher priority to receive pass-through funding dollars. Also, it is critical that NSMA take a significant stakeholder position in the creation, maintenance, and oversight of the program. We also urge that the Practice in Nevada program be expanded to not only areas that are designated federal HPSAs, but open to all of Nevada as our provider shortages are statewide. We understand submission of a waiver is required by law, but we strongly urge the thoughtful revision of the proposal. Thank you so much for your consideration of these critical matters. We will be submitting this in writing with expanded details. Thank you.
Thank you for your public comment. Next, we have Patrick Kelly. Please go ahead.
Good afternoon. My name is Patrick Kelly. I'm with the Nevada Hospital Association. We appreciate the governor and Medicaid creating the new market stabilization program. It has the potential to address some of the concerns we've been raising since SB 420 passed. First, it can stabilize the health insurance market in Nevada. This is essential to maintaining a robust healthcare delivery system. Second, the market stabilization program's incentive payments to insurers can be designed to encourage payments to providers above Medicare rates. This will help with provider participation in the program and with the recruitment and retention of providers. The program's Practice in Nevada incentive will also help alleviate our health professional shortages. Remember, affordable health insurance won't mean much if you can't access a doctor. We recognize that some families struggle with the cost of health insurance. However, we don't believe that every family fits that description. Some enrollment limitations are needed. The focus should be on providing health insurance to those who are ineligible for other programs or who pay extraordinary premiums and deductibles. For example, Nevadans who are eligible for Medicaid should not be allowed to participate. A means test should be administered to assure people who are not paying for insurance that they can get for free. On the other side of the economic spectrum, affluent families shouldn't be allowed to shift their healthcare costs to Nevadans who have commercial insurance. It's not fair, and it will only disrupt the commercial insurance market. Guardrails are needed. Many challenges lie ahead, but we look forward to working with the administration and the legislature to address them. Thank you very much.
Thank you for your public comment. Next, I have a caller with the last four digits of 5568. Please go ahead to unmute and provide your public comment. Again, caller with the last four digits of 5568. Please feel free to unmute and go ahead with your public comment. I'm unable to unmute you. Oh, okay. If you would like to provide your public comments in writing, you can do so. There's an email address that's included on the notice to this meeting. That's 1332 waiver program at dhcfp.nv.gov. We do have another public comment, caller with the last four digits of 4955. Please feel free to unmute and go ahead. I apologize. It looks like we're having technical difficulties. I can't unmute you on my side, and it looks like the callers may be having issues unmuting themselves.
Which number, Melinda, did you just call out?
The last four digits are 4955.
Let me see if I can unmute. Who has the capability to do that? Did you guys set this? I mean, I'm just trying to think. Is it not on your side, Melinda?
Correct. We don't have that capability here on the master console either.
Can any of the callers just maybe unmute themselves so we can see if we can hear anyone that's called in? That's on the phone?
Can you hear me?
Can you hear me?
Yeah, yes, okay, good.
Okay.
So some people are working. Okay. Callers, if you're trying to speak and you can't, you can submit, you can call back in and try it again if you want. We will go back through and see if we can pick you back up that way. Melinda, did you want to keep going down the list?
Melinda, this is Monica.
Oh, hi, Monica.
Hi, perhaps callers could try the *6 to see if that helps unmute.
Oh, great, that worked.
Thank you. So I think I have caller 4955. Please feel free to go ahead.
Hi, can you hear me?
Yes, we can. Thank you.
Okay, I'm not for sure if that's my number. It didn't give me a number.
Okay, that's all right. Go ahead.
Okay, well, hi, my name is Jemima Gildersleeve, and I'm new to Nevada, coming from Northern California, and their medical system is structured different. The income threshold for the families in California is much higher to obtain supportive services. I moved to Nevada from California for many reasons, but once I got here, I quickly began to see and rethink my decision for coming here. The supportive services are scarce, and the housing prices are, in my opinion, is extremely sad. But my main issue is for medical. I currently work for a temporary agency that does not offer medical insurance, and I make the above income medium in Nevada to obtain the government medical services. I'm not knowledgeable of the laws that govern Nevada, but what I do know is I have been shut down and denied certain services because I make too much money, but definitely not enough to survive here. I received a flyer explaining the public option health plan, and I'm excited to know that there will be an option available for people like me that are stuck in the medium. I definitely support the public options, and I can't wait for enrollment to start. This will be a good option for people of Nevada. Thank you.
Great. Thank you so much. And thank you, Monica, for the *6. All right. We do have one other caller with their hand raised. So if the other caller could please press *6 to unmute, and please go ahead.
Can you hear me?
Yes, we can. Thank you.
My name is, excuse me, my name is Martin Fitzgerald with New Day, Nevada. I want to thank Senator Canizaro for passing and Governor Lombardo for implementing SB 420. This innovative policy and implementation plan takes a new approach to delivering affordable quality health care to Nevadans and offers the opportunity to dramatically reduce the cost of health care in the state. By leveraging the state's purchasing power through Medicaid, the state is down costs for consumers on the individual market and enact critical reforms in the Medicaid market. While Nevadans will be able to benefit from this policy, while all Nevadans will be able to benefit from this policy, one of the biggest beneficiaries will be Nevada families that make too much money for federal premium supports, but are still priced out of health insurance. These are not rich families. These are middle income, in some cases, low income families that have not been at the center of the healthcare affordability conversation. In Nevada, a family of 4 with 2 working parents would not qualify for any premium support if each parent makes just $60,000 a year. That is just slightly higher than the average annual salary in Nevada of about $59,000 a year or $28 an hour, according to ZipRecruiter. These families need help and support, and this policy delivers exactly that. For the first time, these families will have a public option, which will allow them to see reduced premiums so they're able to secure more affordable quality insurance. For the first time, we'll have a state-based policy focused on consumers less than the gap between income levels and allow families to actually afford insurance and achieve government subsidies allow for low-income families. In addition to the real benefits, the state's State's 1332 waiver application also has important provisions dedicated to addressing Nevada's decade-long provider shortage. Nevada was ranked 48th in the nation with regard to availability of primary care physicians, and a report by UNR School of Medicine found that Nevada needs more than 2,500 additional providers just to meet the national average. Some of the main ways we can address this is funding workforce development initiatives like state-based residency training slots, expanding pay parity and scope for APRNs, and tearing down the barriers that prevent healthcare providers from moving to and practicing in Nevada. These are important reforms, and we encourage the state and CMS to look at comprehensive reforms and best practices that Nevada can engage in, along with the funding that will be provided through this 1332 waiver to truly rebuild and expand Nevada's network of healthcare providers. We need a healthcare infrastructure that can actually meet the needs of Nevada families, and the 1332 waiver application provisions focused on workforce development are essential, and we are strongly in support of them and thankful for their inclusion. Finally, we wanted to point out and applaud the outcome-based payment reforms included in SB 420 and the 1332 waiver application. For far too long, Nevadans have been suffering under a healthcare system that is among the most expensive in the nation, with some of the worst healthcare outcomes in the nation. It is indeed the inverse type of healthcare system you actually want. Instead of low cost, high quality, we suffer from high cost, low quality. By modernizing Nevada's payment system so that we incentivize healthcare providers to focus on patient outcomes, Nevadans can drastically and practically address this issue. We can deliver in the individual market some of the same reforms that we are already seeing in the Medicare and Medicaid markets. Over the long term, these incentive-based payment solutions can finally change our healthcare system that has been focused on maximizing profits for insurers while demonstrating indifference to patient care and patient outcomes. We want to thank DHHS and Medicaid for this application, and we would like to remind everyone, including apparently the current providers of MCOs, that MCOs already offer exchange plans and have been required to do so for years. We encourage DHHS and Medicaid to continue to explore the additional administrative actions and reforms that can realign Nevada's healthcare system to the benefit of consumers and Nevada families, and not simply deliver an additional point or two in profit margins to some of the largest healthcare corporations in the world. Thank you.
Thank you for your public comment. We do have one more hand raised from a caller. So caller, if you could please press *6 to unmute, and please go ahead with your public comment.
Here.
Yes, we can hear you. Thank you.
Awesome. I was the first guy who couldn't make it through. Thanks for the *6. I'm Larry Flannery. That's Flanrey, and I am representing For Our Future Nevada. And the comment I'm going to read today is actually from my wife, who couldn't join us today, but asked me to read this in her place. In 2018, I worked at a daycare as a staff teacher. They scheduled me under 38 hours a week to keep me part-time and from getting benefits. One day I started to feel an overwhelming pain, and not having insurance, I waited before seeking medical attention, hoping it would get better on its own. It did not. When I finally received medical attention 3 days later, I was close to death as a cyst was growing on my ovary, and that the cyst was 3 times bigger than the ovary itself, and it was causing my body to go septic. The bills I received after nearly bankrupted me, and some were sent to collections when I could not afford the payments. I had just turned 21 years old. If the public option had been in place at the time, I might have been able to have saved my body from being mutilated, risking my ability to have children, and save myself from crippling debt. Hopefully the public option will keep others from having a similar story to me. Thank you.
Thank you for your public comment. If we have any other individuals who would like to raise public comment, please use the raise hand feature in the Teams platform, or if you are calling in, please press *5 to raise your hand. Do we have any other public comment? Okay, it looks like we do not. In that case, I'm going to hand it off to Michael to talk about next steps.
Okay, as mentioned earlier, public comments will be accepted through December 20th, 2023. Again, written comments can be sent to 1332 waiver program at dhcfp.nv.gov. And we will be accepting those again through December 20th. The 1332 waiver application will be submitted to the federal government by January 1st, 2024. And here's some additional contact information. You can email our administrator, Stacy Weeks, Melinda Southard, our deputy administrator, or myself, Michael Gordon. And there's our contact information if you had any further questions or concerns.
And then just wanted to hand it off to Stacy if you wanted to provide any closing comments.
Thank you, Melinda and Michael. I just want to say thank you all for joining us this afternoon. This, like Michael said, completes our hearings for the public comment, but we are still taking public comment and look forward to reading some of the formal submissions. We also will be doing our best to respond to the topics that are raised. So when we do issue our final application, you will see our responses to all the different issues that were raised. So I just want to let you know that we will be answering and considering all your feedback. It's just right now we want to collect it and then we'll go back and do some of that work. But thank you all for joining us. And in the meantime, don't hesitate to reach out. Have a good afternoon. Thank you.
Great, thank you.